Endoscopy has been a medical breakthrough used for diagnosing many illnesses. Dr. Steven Steinberg of Boca Raton Regional Hospital joins us this afternoon to answer your questions about therapeutic endoscopy. Thank you so much for joining us. We appreciate your time. Now, this is your specialty, advanced therapeutic endoscopy. Therapeutic endoscopy, what does that mean?
Well, I think most of your viewers are familiar with endoscopy, looking with a scope in the stomach, and colonoscopy that many of your over 50s have undergone. This is an extension of that, using a more advanced technology to be able to both diagnose and evaluate and treat certain conditions. People who have undergone ultrasound, for example, during pregnancy, have a probe that looks through the abdomen at the unborn baby. We have that technology, for example, now on the end of a scope so that we can look within the body at adjacent structures, evaluate, and do therapy as necessary.
Is it sort of like minimally invasive surgery?
It's similar, and we use the same kinds of techniques and the same approach. The idea is to be able to address a problem for a patient without having to do an extensive operation that might require hospitalization and an extended recovery time.
So what types of things do you look for with a therapeutic endoscopy?
Well, for example, anybody who has a tumor of the esophagus, of the stomach, of the pancreas, of the colon, of the lower colon, could require endoscopic ultrasound, this technology I just described, to both evaluate the extent of that tumor and in some cases to actually go ahead and treat the tumor without requiring surgery.
Well, I was going to ask you then, can you use this to treat certain types of diseases?
For early cancers of the colon, for early cancers of the esophagus and the stomach, we can actually use this technology to decide that a patient is a candidate for this kind of therapy and then to go ahead and remove the tumor without requiring some extensive surgery.
It must be amazing to you, just on a personal note level, when you treat people with this compared to what some of the treatments used to be in terms of downtime, pain, recovery, things like that. It must be amazing to you to see this type of advancement.
Well, having had the opportunity to watch this over the better part of 25 years and to see where we've evolved to, the fact is we now do things that used to require 6 to 7 days in the hospital, a significant operation, 4 to 6 weeks of recovery, and we now do things like that as an outpatient.
And they go to work in a couple of days.
They go to work the next day.
Isn't that amazing? Now, so that's the recovery time after endoscopy, but what other things do you do with this, with therapeutic endoscopy?
Well, as mentioned, we can actually take off early tumors if they meet certain criteria that make them amenable for cure under those circumstances. We can do treatments that involve the treatment of pain for people with malignancies. We can evaluate and drain collections and infections within the abdomen that used to require extensive surgery, and it can now be done literally with treatment that the patient wakes up and doesn't know anything has been done.
And all these advancements benefit patients. Thank you so much for your time. We appreciate it.
My pleasure.
Boca Raton Regional Hospital sponsors our expert and also underwrites our Ask the Doctor segment. We're back with more in just a moment.